two environments that I'm working in right now are emergency departments. One is a rural setting in North Dakota where, honestly, I could speak to preparation. They're not really seeing a lot of cases there. The other community is a retirement community in Florida. That community, we're seeing quite a few people under what we call patients under investigation or COVID positive patients. You can imagine that community has the potential to be a hotbed or a hotspot
Right.
with a lot of nursing homes, acute care facilities, like ALFs or what we call, just assisted living.
Right. Right.
So elderly patient, immunocompromised patients over the age of 65. And of those patients that we're seeing, for the most part, being in the front lines, my main role is to screen these patients and to make sure that we're protecting not only the patients themselves, but the staff from exposure. The nursing staff would certainly be someone that I would want to circle and recognize because they're the ones who really are the most vulnerable. They're really their contact with these potentially positive patients is much more significant than mine as a physician assistant or the physicians themselves. The treatments, obviously, that's what's, we're kind of looking at how to manage these patients, but in terms of hands-on, it's your nurses, your respiratory therapists, even your x-ray techs. These are the ones that are having to move the patients and really exposing themselves to, the potential of contracting the virus. We've all been assigned respiratory masks, N95 masks.
Right.
Those are our own. They're using daily. We leave the masks at the hospital. They're using high dose UV exposure to kill the virus, and then basically give us these masks back. So basically, you just have one mask, eye protection, and both of these things we're wearing, pretty much throughout the day. In terms of patients, when you're getting in close proximity, then we'll actually don and doff, like a personal gown that we change out with each patient. So for the most part, that's what our personal protection equipment looks like. There's also some devices that we use if we have to get very close to do like what's an intubation where we're actually putting a endotracheal tube in. There's a high incidence of people getting exposed to the virus this way. And so we have a plexiglass shield basically that we put over the patient. You can actually put your hands through and do the intubation, through
Wow.
that. So it's one other, way of shielding yourself from potential exposure.
Yeah.
In terms of going home, obviously I undress. My neighbors love me because, I come home, I undress right there on the front doorstep and then make sure come in and shower right away. So, that's basically the extent. And then, practicing good hygiene and, just making sure that I'm disinfecting the house pretty regularly. Yeah, I mean, for the most part, balancing, self-care. And obviously everybody has a different approach to that, going for a run, yoga, exercise, I would highly recommend, for obviously many different reasons, mental health as well as, boosting your immunity. But, in my case, staying away from social media and that only adds to the stress that, we already face on the front lines. Outside of that, the rigors of long hours and just getting good rest. So,
Yeah.
that's basically it. And having the ability to check out, from time to time. And, again,
Right.
the media or social media or just, your phone in general, just taking some time off, is really what I, for my own personal sake, find most beneficial.